Women that have PCOS typically have irregular cycles. They have clinical or what we call biochemical evidence of hyperandrogenism, which basically means that the male type of hormones are like testosterone are higher than they should be. And last thing is ultrasound evidence of PCOS. So that is certain criteria where they have multiple follicles on their ovary. That having 2 of the 3 of those really is criteria for PCOS. When women present to us that have PCOS, oftentimes they're on birth control pills or they have been treated with birth control pills in the past, so oftentimes they'll tell you that their periods are very irregular. But when they're not on birth control pills, their periods are very irregular, and that can be every 40 days to 2 to 3 times a year. The treatment of PCOS is really to rule out any other issues that may be causing them to have irregular periods, such as abnormal thyroid level, if their prolactin, for example, is elevated. There's certain other entities that are that we would exclude. And then the next question is treatment. And the treatment really depends on if they're trying to get pregnant or if they're not trying to get pregnant. If they're trying to get pregnant, then our goal is really to give them medication to allow them to develop a follicle in a very physiological way, so that it's ovulated at the right time during their cycle when that follicle is mature. That can involve being placed on oral medications such as Clomid or Letrozole, which is another medication that we've been using much more now. And that can be either used alone or in conjunction with FSH, with follicle stimulating hormone, which is given in a subcutaneous way to allow them to develop a follicle, several follicles, in a physiological way, whereby when that follicle reaches a certain size, they would take a trigger shot and then either have timed intercourse or artificial insemination.